Is your sniffer stopped up? Hi, I'm Dr. Crockett, and this is Dr. Crocker with Zeal Integrated Health. And one of the most hidden underlying infections is a sinus infection. It often happens in the sinus cavities.
Yep.
And these chronic just sinusitises are affecting about 17% of the adults out there. And they struggle with these chronic sinus infections, and they cause a lot of issues. Long-term nasal congestion,
Yep.
obviously, but some people lose smell. It can even create a place for other infections to develop, and I think that's important in times of COVID, right?
Yep.
So let's talk about some of the symptoms of a sinus infection first, or these sinusitises, and give everybody what they should be looking for
Yep.
if they're dealing with this.
Now, some of these type of symptoms that you're going to be noticing, you wouldn't really put them together with some of the sinus issues that you're having. And one of those things is going to be bad taste and bad breath, and you'll just think, well, did I just forget to brush my teeth this morning? But no, it's reoccurring every single day. You might have lost your smell. Your nose can be really stopped up, so a lot of nasal inflammation. You're going to have thick, discolored mucus that's coming out. So when you blow your nose, unfortunately, it's not the best thing to do, but look at your tissue. Is it clear or is it yellow? I know that's not the best thing, but look at those type of things. And then the other thing is, do you have facial pressure right around in here? Do you feel like you're tender right through there? You know, maybe you're going to blow your nose, or maybe you're putting your makeup on in the morning, you think, my face is a little tender. Those are some of the signs that you want to look for.
Some people even deal with a lot of headaches just because that pressure starts to build. So when we look at causes to sinusitis, there's oftentimes factors that we need to be addressing or identifying to really solve these issues. And what comes to mind when we start talking about causes?
Yeah, so some of the causes that could be is that one of the things is that you have a biotoxin issue. So mold is one of the times that you're going to look at. So mold, whether it's in the place of your work, whether it's in your house, mold is one of those things that really creates allergies. Maybe you've got a deviated septum, or you've got respiratory infections, you've got a weakened immune system. And then the other thing you gotta look at is, are you around someone that smokes, or do yourself smoke as well? Dries out your nasal cavities, gives you respiratory issues, and you're not able to keep your immune system up like you should.
Yeah, I think we see like seasonal allergies impact this. When leaves start falling or things start blooming, obviously that can just upregulate some of that immune activity, and it creates that increase in mucus. One of the things that we saw just in researching this for you guys was that there was a study that they actually swabbed people that were getting ready to have nasal surgery, and they found that I think 96% of these people had fungal infections.
It's a huge amount.
That were driving this. So when we talk about biotoxins, we talk about mold and funguses. These funguses increase mucus, and once you increase that mucus production, you're allowing this ability to trap other bacteria, which is just going to be a breeding ground for infections. And it just sets you up to have chronic sinusitis once that evolves. So how do we prevent these things? What do we need to be doing? What are our listeners need to do to help prevent this type of thing?
Yeah, one of the things is you want to make for sure that you're keeping your nasal cavity moist. It's able to get fluid through there. One of the things, you can use a nasal rinse, whether you use a saltwater rinse or whether you're going to use a saltwater iodine rinse. What this is going to do is basically thin the mucus to where you're able to get the bacteria out, get the mucus out. The other thing you can do is use a humidifier. That's going to help keep the area around you more moist, help it to keep your nasal passages a little bit more moist to keep the bacteria out.
Yeah. I would say things like a clean diet. If you've been somebody that's drank milk, you notice that mucus build up in the back of your throat. So a lot of times, like the dairy and things like gluten can increase mucus production, and you'll benefit by cutting those things out of your diet. Maybe avoiding cigarette smoke or areas where there's cigarette smoke that can irritate those respiratory airways as well. But also just reducing allergens if you can. Sometimes it's filtration systems for the home, keeping the windows closed during those seasons that really see the pollen count, mold counts jump. We want to try to keep that out of the home so you're not taking that in. But also you can use things from a supplemental standpoint, something that can lower histamine activity. That might help to just open up those passageways and allow you to breathe a little bit better. And then things to increase or improve and support immune function. Oftentimes vitamin D, vitamin C, zinc, some oregano oils and things like that can be used in these processes to help support the immune system and maybe fight off some of these things that are evolving there. So I hope this helps you just understand chronic sinusitis and maybe some things that you can do to help yourself with that. And remember to like, share, and subscribe.